Hello, everyone. We are gearing up to release my second clinical guide to help you guys get an edge and be all ready to be amazing in clinical. And I'm going to continue on in my little mini series of videos here. I have a few left, but this one I wanted to talk about setup. So I did put on the Facebook page to let me know your favorite mnemonic. I do have a couple of those mnemonics, the one that I use that is in the original clinical guide. But I just want to run through briefly kind of how to kind of approach your clinical days. Number one, and this goes without being said, but always get there early. By the time your preceptor should get there, you should have that room ready to go, and you should have that patient seen and be able to articulate your anesthesia plan. So get there early and be assertive, guys. You're humans, they're humans. They've all been in your position before. Introduce yourself to people. Walk up to people. Hi, however your school likes you guys introduce yourself. I'm a nurse anesthesia resident from so-and-so. I will be in this room today. Nice to meet you. Just go up to people, be assertive, talk to them. It does really glean you respect for the most part when you do that. And then ask how you can help. If you got your room set up, maybe you got a little bit of time, whatever like that, go over to same day surgery. Ask if you can help with IVs. Do they need fluids made? Whatever it is, just make yourself be helpful. Offer your help to your other students. Maybe they're kind of struggling. Make conversation, get out there, guys, and take charge of your education. Okay? So those are my little helpful pearls there. But as far as getting your room set up, I want you guys to have a systematic approach to how you do it. Build the muscle and build the habit, okay? For me, I'm always thinking, probably because I'm a call shift CRNA, I'm always thinking if somebody just bust through the door with a patient, or I had to get downstairs and get the room ready to go, what's the most important things that I would need to have ready to go? And then I kind of work from there. But it's really important to make yourself a routine so that you don't miss steps every single time, okay? People are going to tell you different things. They're going to give you opinions. Great. Tuck it in your brain. Pick and choose what you're going to take with you when you're a CRNA and out. But for the most part, when you're in that room in the morning, I want you to systematically be thinking, have the same kind of approach as you get further and further along in clinical, and you get kind of used to things, okay? So room setup. So personally, I like to walk right in that door, and I'm going to get that machine checked because I'm not going to get very far if my machine isn't ready to go. So check that machine. I start at the back. I check those tanks. I make sure there's an ambu bag back there. Go over to the front, check all your pipes, make sure those, oh my God, I can't even think of the words, the volatile gas they're piped in at. Make sure that connections are all tight, because I've seen crazy things happen. Go through, every machine will be a little different, oxygen sensor test, leak test, etc. Go through all those things with that. And then don't forget to check your levels of volatile agent, because it would suck to start the case and you've got no SIVO. So make sure you check all of those things. That would be kind of my first thing. Second thing, airway stuff. I'm already at the machine. Let's get my airway stuff together. ET tube, laryngoscope, and blade, Macro-Miller, whatever you're going to be using that day. Your mask, ensure there's actually air in your mask, because that would be the worst. You're trying to bag and it's all deflated, and it's just, you're not going to get anywhere. So make sure, they've been really super not inflated these days. So make sure you inflate that mask up so you can get a good ventilation in there. Do you think you maybe need the glide scope for this patient, or a McGrath or something? Do you need video? Think about that. LMA, always have an LMA somewhere available. LMA is going to be your backup device. If something goes wrong with intubation or anything like that, make sure you have an LMA or something on the top of your card or somewhere so you can show your preceptor, I'm thinking ahead. I have plan B, C, D, E, F, G. And then always have, if you're doing a MAC case, oxygen mask, nasal cannula, but always have backup airway equipment within reach, okay? And you can also lay out an OG tube if applicable. That's also the time I would kind of lay that out as well. You can also lay out bite blocks, oral pharyngeal airway devices, or nasopharyngeal airway devices. Kind of have everything there that you need. Tongue depressors, all that good stuff. Anything with manipulating this. Okay? Tape. Don't forget your tape. After that, I would go to my medication. So I've kind of got, worst case scenario, my machine is working, I got my backup stuff going, I got my airway equipment, medications, fentanyl, Versed, propofol or etomidate, some lidocaine to help blunt airway reflexes and also help with the burn of propofol, succinylcholine, rocuronium, Nimbex, your paralytics, having neo and ephedrine available. Do you got, double check you got glyco and atropine? Is there epi? Kind of pull out those kind of drawers there and just double check and take a peek at all your medications and make sure you're good to go. Every facility will be a little different about how they have you make up some will have the pre-made sticks. Others might have you make a bag of neo at the end of the day. Worst case scenario, I always had a bottle of Sucks and a 10cc syringe next to it. So I'm like, just so you know, I'm ready to go. I'm thinking ahead. Okay. So medications would be next. After that, okay, I've got my machine ready to go, my airway. I can tube somebody. I keep them safe. I can get my drugs. So external monitoring, get your monitor set up, your EKG leads, your blood pressure cuff, your pulse ox, have all of that ready to go. Temperature monitoring, whether you're doing esophageal, nasopharyngeal, or maybe a skin tep. Do you need an A-line? Do you need a fluid warmer? Do you possibly need to put another IV in and you need another bag of LR or NS? Be thinking about those things. Bear hugger. Is there a bear hugger in the room? Do you have an upper or a lower body there? Do you have something to put under the head? Do you have a donut? Do you have a headrest? Is it a prone case? Do you have the whatever prone device they use for the head and neck? Propofol pumps. Do you need a pump for neo or remifentanil, whatever the case may be? Blankets, towels for positioning. So kind of that last thing is that last final check to make sure I have all my other kind of miscellaneous things I'll need to start the case. Okay? So I hope that was helpful. Remember, systematic approach, build habits, build the muscles, get there early, talk to everybody, be assertive, own your education, and enjoy it. No matter what happens, cranky people, whatever, it doesn't matter. You're there to learn and to become confident and to be safe. So walk in that and enjoy your clinical experience. And I will be back tomorrow with another video. I think we're going to talk about, teeth or positioning, one of those ones. We'll be talking about those soon, okay? Bye, guys.